Please see important safety information near the end of this video. Please see link for the full prescribing information, including the medication guide for Skyrizi. Uses. Skyrizi is a prescription medicine used to treat adults with moderate to severe plaque psoriasis who may benefit from taking injections or pills, systemic therapy, or treatment using ultraviolet or UV light, phototherapy, active psoriatic arthritis, moderate to severe Crohn's disease, moderate to severe ulcerative colitis. Safety considerations. Do not use if you are allergic to Skyrizi. Skyrizi may cause serious side effects, including serious allergic reactions, an increased risk of infections, and liver problems. Stop using Skyrizi and get emergency medical help right away if experiencing symptoms of a serious allergic reaction. Before starting treatment, your doctor should check for infections and tuberculosis. Tell your doctor right away about any infections or symptoms of infection, and about planned or recent vaccines. Liver problems may happen while being treated for Crohn's disease or ulcerative colitis that can lead to hospitalization. Your doctor will do liver blood tests before and during treatment and may stop Skyrizi if liver problems develop.
How do I know if my insurance covers Skyrizi?
Insurance. When I was prescribed Skyrizi, my first thought was, awesome, let's do it. My second thought was, I hope it's covered. To find out, I called Skyrizi Complete, and they put me in touch with an insurance specialist. She reviewed my insurance plan, which confirmed my Skyrizi was covered, and let me know how much my out-of-pocket cost would be. Since I have commercial insurance, she also explained how I can get this savings card to help lower my costs, which is a huge help. If you haven't already, definitely give them a call and ask them about ways to save. It's so worth it.
Anything I should have handy when I call an insurance specialist?
Let's see. You'll want to have your insurance cards with you. You could just have one for all of your medical benefits, or you may have a second card just for prescriptions. They'll ask you for your name and address and maybe your doctor's contact information. Don't worry if you don't have everything. Just call and ask to speak to an insurance specialist. They can help you figure it out.
What if there's a change in my coverage?
Sometimes things happen that can make your insurance change. One thing I was surprised to find out came up when it was time to renew my insurance plan. Even if you keep your current coverage plan, your deductible and out-of-pocket costs could still change. That's why you should always call an insurance specialist when you need to review your options or anytime you have an insurance question. Now that we have a handle on insurance, I'm gonna go do me. Insurance can be pretty manageable if you remember these 4 things. Gather your insurance cards and doctor's info, call Skyrizi Complete and speak with an insurance specialist, have them check if your plan covers Skyrizi and ask about your costs. And remember, it's 1-866-SKYRIZI. Just call and ask to speak with an insurance specialist.
Important safety information. What is the most important information I should know about Skyrizi? Risankizumab-rzaa. Skyrizi is a prescription medicine that may cause serious side effects, including serious allergic reactions. Stop using Skyrizi and get emergency medical help right away if you get any of the following symptoms of a serious allergic reaction: fainting, dizziness, feeling lightheaded, low blood pressure, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing or throat tightness, chest tightness, skin rash, hives, itching. Infections. Skyrizi may lower the ability of your immune system to fight infections and may increase your risk of infections. Your healthcare provider should check you for infections and tuberculosis, TB, before starting treatment with Skyrizi, and may treat you for TB before you begin treatment with Skyrizi if you have a history of TB or have active TB. Your healthcare provider should watch you closely for signs and symptoms of TB during and after treatment with Skyrizi. Tell your healthcare provider right away if you have an infection or have symptoms of an infection, including fever, sweats, or chills, cough, shortness of breath, blood in your mucus, phlegm, muscle aches, warm, red, or painful skin, or sores on your body different from your psoriasis, weight loss, diarrhea or stomach pain, burning when you urinate or urinating more often than normal. Do not use Skyrizi if you are allergic to risankizumab-rzaa or any of the ingredients in Skyrizi. See the medication guide or consumer brief summary for a complete list of ingredients. Before using Skyrizi, Tell your healthcare provider about all of your medical conditions, including if you have any of the conditions or symptoms listed in the section, "What is the most important information I should know about Skyrizi?" Have an infection that does not go away or that keeps coming back. Have TB or have been in close contact with someone with TB. Have recently received or are scheduled to receive an immunization, vaccine. Medicines that interact with the immune system may increase your risk of getting an infection after receiving live vaccines. You should avoid receiving live vaccines right before, during, or right after treatment with Skyrizi. Tell your healthcare provider that you are taking Skyrizi before receiving a vaccine. Are pregnant or plan to become pregnant. It is not known if Skyrizi can harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Skyrizi passes into your breast milk. Become pregnant while taking Skyrizi. You are encouraged to enroll in the pregnancy registry, which is used to collect information about the health of you and your baby. Talk to your healthcare provider or call 1-877-302-2161 to enroll in this registry. Tell your healthcare provider about all of the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Skyrizi? Skyrizi may cause serious side effects. See, what is the most important information I should know about Skyrizi? Liver problems may happen while being treated for Crohn's disease or ulcerative colitis. A person with Crohn's disease who received Skyrizi through a vein in the arm developed changes in liver blood tests with a rash that led to hospitalization. Your healthcare provider will do blood tests to check your liver before, during, and at least up to 12 weeks of treatment, and may stop treatment with Skyrizi if you develop liver problems. Tell your healthcare provider right away if you notice any of the following symptoms: unexplained rash, nausea, vomiting, stomach, abdominal pain, tiredness, fatigue, loss of appetite, yellowing of the skin and eyes, jaundice, and dark urine. The most common side effects of Skyrizi in people treated for Crohn's disease and ulcerative colitis include upper respiratory infections, headache, joint pain, stomach, abdominal pain, injection site reactions, low red blood cells, anemia, fever, back pain, urinary tract infection, and rash. The most common side effects of Skyrizi in people treated for plaque psoriasis and psoriatic arthritis include upper respiratory infections, headache, feeling tired, injection site reactions, and fungal skin infections. These are not all the possible side effects of Skyrizi. Call your doctor for medical advice about side effects. Use Skyrizi exactly as your healthcare provider tells you to use it. Skyrizi, risankizumab-rzaa, is available in a 150 milliliter pre-filled syringe and pen, a 600 10 milliliter vial for intravenous infusion, and a 180 1.2 milliliter or 360 2.4 milliliter single-dose pre-filled cartridge with on-body injector. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. If you are having difficulty paying for your medicine, Abbv may be able to help. Visit Abbv.com/patient access support to learn more.